Acupuncture is gaining in popularity, especially with people who have chronic pain. Next week, the Center for Healthy Living will be holding a special lecture on that subject. Joining us to talk about it is Deidre Braun, about the treatment and the history of acupuncture. Good morning, Deidre.
Good morning, Gina.
All right, let's talk about acupuncture. I mean, let's face it, most of the world has this aversion to needles because they hurt. Why would you ever voluntarily go into a place that is going to stick you with needles?
Well, for one thing, they don't hurt. They're only like 34 gauge needles, so they're very small.
We'll try to get a shot of that, but yeah, these are, I would say, I mean, I don't even know how to describe it as far as how thin they are.
Like a hair.
Like a hair. There you go. That's perfect. I don't know if you can see that at all, even on the TV cameras now. So that's part of the reason it doesn't hurt, is that the needles are very, very sharp.
Right.
And very, very thin, like literally a strand of hair.
Right.
Now, in your training, which is obviously an ancient Eastern traditional kind of medicine, tell us about what you're taught about the human body that might be a little different than what a regular doctor is taught about the body.
Right. Well, for one thing, it's a 4-year program. So you go to school for 4 years full time, and I went to a school in Santa Monica. But you learn about yin and yang and excess and deficiency, and you know, it's just, in the beginning, it's overwhelming, all the different, how they describe medicine. But you also learn the anatomy of the body. But like for this particular needle right here, I'm using this needle right here to treat her right shoulder.
Okay, so this one is actually in her left calf.
Right.
Right about here. And that's going to relieve pain in her right shoulder?
Mm-hmm.
Okay.
As well as these needles along her ankle, because...
Okay, well, I'm going to lift your leg just a little bit carefully now. You've got 5 needles in and around her ankle and heel of her left foot. And this is treating what?
Her right shoulder. It could also be treating her hip or her low back as well. But these meridians are paired with meridians in the opposite part of the body. And so by treating them and releasing that energy and get it to flow again, you're changing the pain in the opposite side of the body.
What would you say to somebody that says, no, I want my board-certified doctor with his scalpel and his prescription pad?
Well, that's fine. I mean, there are some people that don't want to do complementary medicine, and that's fine. But the people who do want for alternatives, they don't want to take medications, or they can't take pain medications or anti-inflammatories because it affects their stomach, those patients do very well with acupuncture.
No, I've noticed, and actually it was mentioned earlier, that it's not alternative medicine. You're not saying don't go to your doctor.
No.
You're saying in addition to.
In addition to. If you have a traffic accident and you break your arm, you're not going to come to an acupuncturist until the arm has been set. Then you might come to the acupuncture after the arm is set and the trauma is over to speed the healing and reduce the pain, but you wouldn't come to us to set that fracture.
Right. Now, we're talking a lot about chronic pain right now and relieving stress, but also something that acupuncture has been proven effective for is breaking bad habits. Talk to us about that.
Addictions. You can treat addictions with acupuncture. Actually, when I finished school, I went and worked at UCLA for the study for addictions and treated cocaine addicts for 20 months. And we only did auricular acupuncture, meaning we only put 4 to 5 needles in each ear, and then they would relax for 40 minutes. So you can treat food, smoking, alcohol, drugs.
Wow. Okay, let's show what it's like putting a needle in. Now, here, let's go with your left hand and just show us real quickly here what it's like and how easily, here, let's get a shot there. So what you've got is a little tube.
And the tube is slightly shorter than the needle, and I tap it in, and then I insert the needle.
Okay, now, Rami, did you feel that at all?
Not at all.
So little or no feeling, not even a little, like, pinprick, or literally in this case?
Barely, yeah.
Barely. All right, so let's go ahead and put in a couple more just because it's really fun for me to watch you put needles in Rami. And real quickly, tell us about the lecture coming up while you put these needles in.
On June 18th, we're giving a lecture at the Center for Healthy Living, and it's at 4:30 in the afternoon, and it includes dinner, and it's about acupuncture and herbs and all the different diseases or problems that it treats.
Right, and if you'd like more information, that phone number is 568-1234. That's 568-1234. Okay, just keep sticking needles in Rami until we get back from the commercial break.